Hey everyone, it's Manda with My Life, My Way. If you watched my video from yesterday, you probably know by now that we've had a miscarriage, which basically means that our baby has died and my body is not removing it. My body's sort of hoarding it, holding it onto it. So we've had to do a follow-up with the early pregnancy loss clinic and take some steps to remove the embryo from my body. Which, while hard, has to be done for a couple of reasons. For one, because you need it to move on. You can't keep going like that. And for two, because the longer it sits there, and sort of degrades and sort of breaks down, the higher incidence of infection and stuff, which can cause damage to the uterus, which can damage our chances for conceiving another baby. So today we had an appointment with the early pregnancy loss clinic. It was actually really nice. We had a nurse named Taffy. She was amazing. She was fantastic. She probably isn't the best line of work she's ever had. She's wonderfully supportive without being so soft and mushy that she encourages you to cry even more. She asked how we were holding up. I told her we've been kind of going back and forth between the ugly cry stage and the gross joke stage. I'm an EMT. We deal with things with dark humor. That's just like how we kind of go from one day to the next. Some days, if it's been a really, really rough day, you kind of turn it on its head and make it something you can tolerate. And we've been doing a lot of that. So one of the things they gave us was this pamphlet, or folder, I guess, full of information. It has pregnancy loss information in it. It has what to expect out of these medications that they're going to give us and the miscarriage itself. They gave us follow-up blood work in there. There's also support networks for loss, specific to different situations, because people lose babies at different stages. Everything from this early pregnancy, which we lost, our embryo only lived till 8 weeks and 3 days, but we didn't find out till 11 weeks and 1 day. So that was kind of hard. But it can go all the way up to stillbirth, or even newborn death. So they have all kinds of information in there, which I thought was really nice. They also gave us this teddy bear. Apparently it's part of their new initiative to send moms home that have lost babies with something you can take home, which I thought was really sweet. Sorry. Another thing they sent us home with was a journal so you could chronicle it. They sent us home with some really nice poems and information about sort of how to move on and how to get yourself past this and to a better point mentally. They also gave us forget-me-nots, which you can plant in memory of your lost infant, and a candle you can light for them as well. So I thought that was kind of cool. It's not just, here's your drugs, here's your information, and off you go. There's some sort of tender loving care that goes along with this package, which I thought was really neat. As for the actual medications, so this is a medication that they're having us take. There's 4 tiny little tabs in there. It actually started out as an arthritis medication. It's called misoprostol, something along those lines. You insert them vaginally, put all 4 in, and within half an hour to 4 hours, the cramping and the bleeding will start. And the early pregnancy loss clinic actually follows up with us every day, just to make sure that we're doing okay, how much have we passed, making sure that we don't need any more analgesia or anything along those lines, which I thought was really cool. They do give you a pack of ibuprofens. They tell you to take 3 before you insert, and it's a 2-day process, so we're going to do it once today, and then 24 hours at pretty much the exact same time, you take it again the next day. Just to make sure that kind of everything's gone. Some doctors only do 1 day and then they kind of reevaluate. My doctor's sort of basic general is to do it twice for 2 days, and it should kind of get rid of everything. And then if you don't miscarry from there, they might do a 3rd round, or they may just say you can kind of wait it out, or they may go straight to a dilation and cleaning, so a D&C. They did give you some Mucogel, or they gave me some Mucogel to kind of make insertion a little easier. which is super. Some gravel, because apparently it can upset your stomach. Apparently that was worse when you used to take it orally. Vaginally should take care of most of that. And then they did give us some Tylenol 3s that we can take I can take if the pain gets pretty bad. They gave us some gloves as well. They also gave us some of the little blue pads. We use them a ton on the ambulance. If you're going to start IV lines or do anything where there might be some blood and some runoff, that kind of thing. And they give it to you so you can put them on the bed so you don't stain your sheets, that kind of stuff. These sheets we actually wrecked in the washing machine. And I noticed when I put them on the bed the other day, I wasn't too worried about it. I figured, whatever, we can let it go for 2 weeks. So I'm going to throw out dirty sheets instead of throw out clean sheets. And then we found out like 2 days later that we'd miscarried. So if these get tossed in the garbage, that's where they were going to go in the first place. So at least that's not so bad. Yeah, they give it all to you in this nice little bag. Has a cute little quote on it. And this is kind of the bag they give to everybody that loses an infant. And the information you need in it. So it's not so bad. I figure we can do this. I'm about 20 minutes shy of putting in our first dose, and we'll see how that goes. I'll do another video tomorrow, let you guys know how it went. Actually, I might do it in 2 days. I might do it once we're done both cycles. And we'll kind of see how everything's going from there. And let you kind of know the plan. And for this pregnancy, that was pretty much it. Short-lived. Okay, see you guys later.